A doctor has told you that you need a knee replacement. Maybe more than one doctor has told you this, and you have been told, don't delay. It'll only get worse. And now you are scared. You are Googling at midnight. You're watching videos like this one because something inside you is asking, do I really need this? Is there another way? I want to talk to you directly because I understand the surgery from the inside. Earlier in my career, I performed complex knee replacements, bilateral, revision, high-flexion, gender-specific. I have stood at the operating table and done this procedure hundreds of times. And what I saw from the operating table itself is that knee replacement is one of the most frequently over-recommended procedures in orthopedics, particularly in India, particularly in settings where the pressure to fill operation theatres is real. Today, I no longer perform replacements. My entire practice is joint preservation and biological treatment. And I made the transition deliberately because I became convinced that too many patients were going to surgery before every alternative had been genuinely explored. In this video, I'm going to give you 5 signs that suggest you may not need a knee replacement yet and what you should explore instead. I'm also going to tell you honestly when replacement is the right answer because I won't pretend it never is. I am Dr. A.K. Venkatachalam, founder of the Madras Joint Rejuvenation Center, Chennai. I am a fellow of the Royal College of Surgeons, UK trained with 4 decades in orthopedics. Earlier in my career, I performed complex knee replacements, bilateral, revision, gender-specific, high-flexion procedures. I know exactly what the surgery involves, what the recovery demands, and what the risks are. I no longer perform replacements. My entire practice today is joint preservation and biological treatment. And the reason I made the transition is precisely because I saw from the operating table itself how many replacements were being done on knees that did not yet need replacing. Because I have done the surgery myself and I have chosen to step away from it. That experience is why you should listen to what I am about to tell you. My philosophy is simple. Knee replacement is the last resort, not the first response. The goal is always to preserve your natural knee for as long as possible or permanently where that is achievable. Let's go through the 5 signs. Sign 1. Your arthritis is grade 1, 2 or 3 on the Kellgren-Lawrence scale. Knee arthritis is graded from 1 to 4. Let me explain what each means. Grade 1 is very early. Minor changes, joint space preserved. Grade 2, some narrowing, early osteophytes or bone spurs, but cartilage is still present. Grade 3, moderate narrowing, more osteophytes, early bone changes, but still cartilage remains, joint space remains. Grade 4, severe, bone on bone contact, cartilage gone, joint space collapsed. Simpla solemna. Grade 4, nothing left to preserve. Grade 3, still something to save. Knee replacement is indicated at grade 4. For grade 1, 2 and 3, replacement is premature. There is still tissue that can be supported, treated and preserved. If you have been told you need a replacement but your X-ray shows grade 1, 2 or 3, get a second opinion every time. At MJRC, grades 2 and 3 are exactly the patients we treat most successfully with PRASAD, our 3-layer biological protocol treating cartilage, joint space and bone. Sign number 2. You still have good days. If your pain fluctuates, if there are days when you walk reasonably well, climb stairs, move around the house, your knee still has functional reserve. End-stage arthritis is constant, unrelenting pain. Pain at rest, pain at night, pain that responds to nothing. If you have good days and bad days, your joint is still biologically responsive. It has not failed. That is a joint worth treating, not replacing. I have seen patients advised bilateral replacement who still walk to the temple, cook, function daily. That function matters and it can be built upon. Sign number 3. You have not yet tried properly targeted biological treatment. Most patients have tried painkillers, steroids, lubricant injections, but not a comprehensive biological approach. Not standard PRP, which is often underdosed and only treats the joint surface, but a protocol that treats all 3 layers: joint, cartilage, bone. And this is where most patients realized they haven't actually tried a complete biological approach. At MJRC, PRASAD does this: PRP, SVF, BMAC, all 3 layers, one sitting. If you have grade 2 or grade 3 arthritis and haven't had this evaluation, you have not exhausted your options. Sign number 4. You're under 65. Knee replacements are not permanent. They last 15 to 20 years. After that, revision surgery may be needed, which is more complex, more risky, and outcomes are never as good as the first surgery. So if you're 55 today, you will likely need another surgery in your 70s. Every year we preserve your knee is a year you avoid that risk. Sign number 5. Your knee has not been properly evaluated. An X-ray is not a diagnosis. A patient is. Many consultations are just X-ray reviews. But proper evaluation includes spine and hip, muscle strength, metabolic health, soft tissue causes. Sometimes the answer is not surgery, not even injection. Sometimes it is physiotherapy. You deserve that full evaluation before surgery. Now, honestly, grade 4 arthritis cannot be reversed biologically. That is biology. And that is when surgery becomes the right decision. If pain is constant, severe, unresponsive, replacement is appropriate. I do not perform replacements, so I have no bias. When needed, I refer, but only when truly necessary. If something doesn't feel right, trust that instinct and verify it. Get a second opinion. At MJRC, we evaluate honestly. If this helped, subscribe, share, comment. Tell me in the comments your age, your arthritis, grade, what you've been advised. I read every comment. Thanks for watching. I am Dr. A.K. Venkatachalam from the Madras Joint Rejuvenation Center.